Well, actually, we know a lot about the biomarkers within the REM behavior disorder space. There are many different biomarkers that are being studied and are well known. Some of these biomarkers are clinical markers that we can detect on the examination. Some of these markers are neurophysiological markers that we can see in, for example, examinations that we do in our sleep laboratory when we do sleep studies. There is increasing interest in tissue and biofluid markers, and that is one of probably the most significant developments, how the field advanced over the past decade, as we now have a really substantially increased knowledge and different types of biomarkers that can be derived from various tissues. For example, from CSF, because that's the environment that is closest to the brain tissue, but also from skin and from mucosal tissues, and hopefully we'll be able to do breakthroughs in having more robust biomarkers of neurodegeneration detected from blood, because that would allow really for a mass screening and mass testing of a general population and understanding these risks of developing neurodegeneration on a population-based level much better. Well, we understand that as the burden of the biomarker presence increases, that these individuals are progressing towards the classically known phenoconversion, when these either cognitive or motor symptoms of these diseases emerge, which is now necessary to diagnose them. For example, there is a really excellent array of imaging biomarkers that are being now under study, and some of them, the most robust one, are focused on the dopaminergic dysfunction and those metrics that then illustrate that there is really embedded neurodegeneration that is occurring with those patients who have those abnormalities on imaging.